Now I am going to discuss how to palpate the transfer process in cervical region. So our palpation will start from the C1 transfer process. So C1 is basically how to identify. It is larger as compared to the rest of the. But how to identify? Basically this location, or you can identify this C1 transfer process. We have three different options to identify it. The first option that is used for localization, that is your angle of mandible. This is arch and this is the angle of mandible. Okay. So just posterior to the angle of mandible, we will palpate for the transfer process. I have already marked here. So the angle of mandible could be used for localization. Second structure is your sternocleidomastoid. So this is the belly of sternocleidomastoid. You can see it. So it is basically found just anterior to the sternocleidomastoid. Next is it is found just below the ear auricle. So we have three different landmarks for localization. It is totally depend upon your convenience. What landmark you are using for localization. So I am using this belly or insertion point of the trapezius. Sorry, this is sternocleidomastoid. Just anterior or just posterior to the angle of mandible. I can feel a bony projection which is coming out from the. It is basically facing laterally. So I just identify it. If you want to confirm it, you can observe the facial expression of the patient or subject. If you apply more pressure, it will be very painful. So when you identify the C1 transfer process, rest of the transfer process you can find out very easily. The second transfer process is the transfer process of C2. So basically it is found underneath the muscle belly of sternocleidomastoid. You can see the muscle belly of sternocleidomastoid. So for identification of C2, there is a rule that you can measure the distance between C1 C2 with the help of patient index finger. Okay? So the patient index finger width is almost the width of my finger. So I can place it. It is little bit thinner. You can observe the, see, it is almost same, little bit thinner. So I am just placing it like this and then try to identify the transfer process of C2, but to identify this transfer process, either you cannot directly apply the pressure because it is underneath the muscle belly of sternocleidomastoid. So either you have to shift it anteriorly and then apply pressure, or you may shift it posteriorly and then apply pressure to identify it. So I can feel the C2 transfer process over here. The relationship of C3 transfer process with the sternocleidomastoid, basically it is found just posterior to the sternocleidomastoid. Transfer process of C3 is basically found just posterior to the sternocleidomastoid belly. So again it is little bit here, the belly is here, so I can shift it anteriorly. It is easy to shift it anteriorly and apply pressure. I can feel the transfer process of C3. The same procedure, basically these three transfer process is you can use the sternocleidomastoid for the reference. Rest of the rest of the transfer process you can feel with previous method. Just place your finger with and under this apply pressure and try to identify the bony projection which is coming out. or which is facing laterally. Again, one finger width, then apply pressure and feel it. So the rest of the transfer process you can feel by repeating the same procedure. So this is the method for identification of C1 transfer process. That's it.